Hello, I'm Dr. Paul Smith from Bangor OBGYN. I would like to take a few moments to talk about a topic regarding deliveries that I think is very important to women, and that's a topic about episiotomy. Should we make a cut to make more room for a baby's head to fit through the vaginal opening, or should we allow a mom to tear? There are a lot of varying opinions that are available in both the lay literature and the medical literature. And I think when I try to distill my 35 years of experience, I think I have to side on the opinion regarding making a cut. There are some experts who say that tears heal better. Hard for me to understand. When I do surgery, I don't tear through the skin because it heals better. I cut through the skin because it heals better. If you can imagine what the vaginal opening looks like as a baby's head is coming forward, if I am going to prepare for an episiotomy, I'm going to put some Novocaine in the area between the vaginal opening and the anus, because that's where there's room to make some more room. And if I need to make a cut, then that goes where the Novocaine is, and it minimizes discomfort for my mom. After the baby is delivered, after the placenta is delivered, I can then use dissolving stitches to pull those tissues together and allow them to heal. Additionally, when a mom takes her feet and puts them in a normal position when her knees are together, it takes all the tension off those tissues right in the middle, and they tend to fold together and heal very nicely. If you imagine a tear for a vaginal opening, a tear can lack the regularity of a cut. It's unpredictable where the tear will go. It might go down the middle, or it might go up over on the side, where those tissues are not anesthetized with Novocaine. So after the baby is delivered, after the placenta is delivered, I have to then take a needle and inject Novocaine in those injured tissues and then sew them back together. More difficult to accomplish. There is some literature that suggests that tearing has a smaller risk of outcome, risk of tearing to the rectum. I think that may be true, but when I look at some of the other literature, it suggests that women who do not have an episiotomy have a higher risk of having bladder dysfunction and the saggy droopies later in life. Now, I don't know any of my moms who says, wow, I'll take a bigger risk for saggy droopies later in life. When I look at the entire constellation of risk and benefit, allowing the baby's head to deliver across a controlled incision in a controlled fashion, with my experience, remains the best option. As always, I am respectful of a woman's right to make a decision regarding this topic. And so I would encourage you to discuss this with me or with one of my co-workers here in the clinic so we can make an informed decision so that your birth experience is precisely the way you would like. Thank you for listening, and I hope my comments have been useful to you.